Hi, I'm Prerna Reddy. I'm the director of the Talk and Learn Rehabilitation Center, Hyderabad. So today this topic is very personal to me. This is about our challenges, what therapists face when we deal with children with autism, on the autism spectrum disorder. What do we as therapists feel and what are our challenges? So the number one challenge is that we recognizing that each child with autism spectrum is different. They have their varied needs, and how we work with them cannot be one size fit all. It is very tailor-made for each child. So recognizing their needs and making it tailor-made for each child that walks into my clinic is a challenge that I face as a therapist. I can't do the same thing I did with the X or Y child with the child Z. My strategies need to fit what my child's unique interests, challenges and demands are. Okay, that's my first challenge. My second challenge is communication differences. A lot of parents that come to us often tell me one thing: you are a speech therapist, I want my child to talk, without recognizing the child's age, the time of intervention and what is the child's capability. So we have to recognize the children on autism spectrum disorder often communicate either non-verbally or verbally, and connection and communication is far more important than thinking and always pestering on the mode of communication. So if my child is older and has still not developed words, I would like my child to be introduced to either signs or gestures or to an ASD device which predominantly fixes my child's communication, which is the child's priority at this point of time. So this is my biggest challenge as a therapist, and I want my parents to understand and change according to their child's need. The third challenge that often occupational therapists face in our clinic is having sensory sensitivities in a child, which can make their therapy environment overwhelming for them. Now these sensitivities can be heightened or reduced sense of sound, texture or movement, or it can also be something to vision. So if it is heightened or it is reduced, it can be very overwhelming for the child, and that's a very big challenge for my therapist to recognize that and accommodate that in my child's therapy and help my child overcome some sensory difficulties. The fourth and the most important point among all three is engagement and motivation. Often when children on the autism spectrum disorder come to us, they are least motivated, to put it in a way. Also, the engagement is very low. So as a therapist, my challenge relies in making the child engaged with me and the child to be motivated to either communicate or even do activities that are important for the child. Now often, how do we overcome this challenge? We either play with the child, we find some creative ways, we find where their interests and strengths are, and then we plan our strategies in such a way that the child is engaged, happy and motivated to perform the task. So these are our four major challenges as therapists, and we want our parents to understand our challenges and help us connect with their kid better. Thank you.